Hi, I'm Rima B. Callado from Section Weidenbach. For this video, I will perform applying cold therapy. But first, what is applying cold therapy? A local application of cold to the prescribed area with the use of crushed ice. And for the assessment, assess the situation to determine the appropriateness for the application of cold therapy. Assess the patient physical and mental status and the condition of the body area to be treated with the cold therapy. Confirm the physician order including frequency, type of therapy, body area to be treated, and length of time for the application. Check if antipyretic medication have been administered. Identify type, amount, time, and response in addition to the cool application. Observe fluid and electrolyte status, especially in patients with elevated temperature. Assess baseline vital signs and assess any hazard to patient's vital functions with the application of cold. For the objectives, first to promote vasoconstriction, second to decrease edema, third to reduce pain, fourth to decrease temperature, fifth to decrease or stop bleeding. The equipment used for this procedure are ice bag, ice collar, glove, commercially prepared cold packs, small towel or washcloth, clean disposable gloves, disposable waterproof pad, gauze wrap or tape, bath blanket.
Step 1. Review the physician order for the application of cold therapy including frequency, type of the therapy, body area to be treated, and length of time for the application. Reviewing the order validates the correct patient and correct procedure. Step 2. Gather the necessary supplies. Preparation promotes efficient time management and provides an organized approach to the task. Step 3. Identify the patient. Determine if the patient has had any previous adverse reaction to cold therapy. This ensures the right patient receives the right intervention. Individual differences exist in tolerating specific therapies. Step 4. Explain the procedure. Discussion and explanation help allay anxiety, encourage cooperation, and prepare the patient for what to expect. Step 5. Assess the condition of the skin where the ice is to be applied. Assessment supplies baseline data for post-treatment comparison and identifies any conditions that may contraindicate the application. Step 6. Perform hand hygiene. Hand hygiene prevents the spread of microorganisms. Step 7. Close the room door or curtains. Place the bed at a comfortable working height. Closing the door or curtain provides privacy. Proper bed positioning helps reduce back strain while you performing the procedure. Step 8. Assess the patient to a comfortable position that provides easy access to the area to be treated. Expose the area and drape the patient with bath blanket if needed. Put the waterproof pad under the wound area if necessary. Patient positioning and use of bath blanket provide for comfort and warmth. Waterproof pad protects the patients and the bed linens. Step 9. Prepare device. Fill the bag, collar, or glove about 3/4 full with ice. Remove any excess air from the device. Secure fasten the end of the bag or collar. Tie the glove close, checking for holes and leakage of water. Ice provides a cold surface. Excess air interferes with cold conduction. Fastening the end prevent leaks. Step 10. Cover the device with a towel or washcloth. The cover protects the skin and absorbs the condensation. Step 11. Put on gloves if necessary. Position cooling device on the top of dressing and lightly secure in place as needed. Use of gloves and leaving the dressing in place prevents the spread of microorganisms. Proper positioning ensures the cold therapy to the specific area of the body. Step 12. Remove the ice and assess the site for redness after 30 seconds. Ask the patients about the presence of burning sensation. These actions prevent burn injury. Step 13. Replace the device snugly against the site if no problems are evident. Secure it in place with gauze wrap or tape. Wrapping or taping stabilize the device in the proper location. Step 14.
Reassess the treatment area every 5 minutes or according to facility policy. Assessment of the patient's skin necessary for early detection of adverse effect, thereby allowing prompt intervention to avoid complications.
Step 15. After 20 minutes or the prescribed amount of time, remove the ice and dry the skin. Limiting the time of application prevents injury due to overexposure to cold. Prolonged application of cold may result in decreased blood flow with resulting tissue ischemia, a compensatory vasodilation or rebound phenomenon may occur as a means to provide warmth to the area. Step 16. Apply a new dressing to site if necessary. Dressing provides protection to the skin. Step 17 or last, perform hand hygiene. Hand hygiene deters the spread of microorganisms.
And for the evaluation, first, edema is low or reduced locally. Second, patient's internal core temperature is reduced. Third, pain is reduced or elevated. Fourth, bleeding is reduced or elevated. And for the recording and reporting, record type, location, and duration of application. Describe the condition of wound and skin before and after treatment, as well as client response to therapy. Report unusual findings to nurse in charge or physician.